Good morning. This video is about looking at publications that have described the use of the ZyMot multi-sperm separation device. It was prompted by a recent article in the Fertility and Sterility Science journal, published in May 2025, where they suggested the impact of microfluidic sperm selection devices as used by ZyMot in cases of sperm DNA fragmentation. And they were comparing centrifugation using density-graded centrifugation and swim-up compared to the one-step ZyMot system. And this study, they argued, provided valuable information on the use of MSDs for non-invasive sperm selection. When MSSDs were used, they observed a reduction in sperm DNA fragmentation in the process sample and an enhancement in the number of usable embryos that they recovered. Their findings could be compatible with a reduced capacity to repair sperm DNA damage due to poor oocyte quality caused by advanced age. And there is a suggestion here that maybe all cycles with poor sperm quality or AMA, advanced age, should routinely use a sperm selection device, maybe just to make the occasional better embryo. So what does the ZyMot data publication data show? The ZyMot is just one of a number of sperm selection devices. I've decided to collect all the publications where ZyMot was described using PubMed and review them in order of publication date as a tool to explore whether SSD should be universally used. I was interested in the concept that many sperm samples contain a variable mixture of spermatozoa with variable degrees of DNA damage, even after density-graded centrifugation. It is up to the zygote to fix this damage, and that if in refining the process to minimize the degree of damage, you may have a better outcome, then that's worthwhile. So does a SSD such as ZyMot lead for better embryology? Even if it has the same outcome, are there still reasons for its universal application in IVF? By way of welcome and disclaimer, my name's James Danger. I'm an embryologist with more than 50 years experience. The videos on my YouTube channel are my attempt to bridge the gap between information you may need for your fertility treatment and the most recent publications available to your clinic. I'm not a medical person, and this information is not medical advice, but it may help you in knowing what questions to ask about your treatment with your doctor, and maybe to help in understanding the advice that you receive. This page I was allocated to potential supporters of IVF Daily. I'm just starting out, but if you want to promote your company or clinical product, this may be just the place. Recognise that in supporting IVF Daily's channel, your support may mean an IVF client becomes a better informed client. You can click subscribe or become a sponsor, or just make a donation to help others on their fertility journey. I did ask whether ZyMot wanted to support this video, but they declined. So back to the paper. In comparing these two forms of sperm preparation, they argued that maybe all cycles with poor sperm quality or advanced age women with advanced age should routinely use a selection device, even if it just makes the occasional better embryo. The reason it's not universally applied is that it could just be that it's cost or time, or that density gradient centrifugation is just a default process and people don't change easily. So what is the published data on ZyMot? And even if there was no difference, a sperm selection device does introduce a degree of standardization into the IVF process. And you have to ask the question, does recent data linking the inability of older eggs to process sperm with DNA damage does now become an important issue which your clients need to be aware of and informed? It may well be that clients should be asking how their sperm will be processed. So the first publication that I could find was published in 2022. This was in addition to the few publications back around about 2010 when the ZyMot was being developed. It's a group by Molly Quinn, etc. from the States. And they compared embryo quality in samples prepared by the ZyMot as compared to density-graded centrifugation. So what was known was that sperm microfluidic sperm preparations can isolate sperm for clinical use with minimal sperm DNA fragmentation, but it's unclear on clinical outcomes. And the answer to this was, in their study, regardless of patient age, if you randomized to fluidic sperm preparations, they had similar cleavage and blastocyst stage embryo quality in clinical and ongoing pregnancy rates compared to those using density gradient centrifugation. So in their hands, they showed it was no better but no worse in the clinical outcome. But if you, okay. The next study was in 2023, Journal of Personalized Medicine, and they showed that in their study, there was no significant difference in the fertilisation rate between the SSD and density gradient centrifugation. But in their hands, they had a higher blastulation and blastocyst rate and also a clinical pregnancy rate. And this was significant. It was basically 51 to 40%. So in their hands, microfluidic preparation of spermatozoa did seem to improve the results. And it may be utilised more broadly for ICSI, but could also improve the workflow in standard IVF labs in decreasing intervention by lab staff and provide more consistent incubation conditions. The next paper was a group published from China. I think they were promoting their lens hook sperm selection device, and they compared that with density gradient centrifugation and ZyMot, and they concluded that the lens hook gave a sample with less sperm DNA and more sperm motility than ZyMot and density gradient centrifugation. I think they're just promoting their own stuff, and it may well be this may be better, who knows. In 2024, there was a sibling study looking at euploidy rate, and in this case, the group reported that the euploidy rate per mature egg was not different between the SSD and density gradient centrifugation. The blastocyst euploidy rate per biopsied embryo was also the same. However, in their hands, the fertilisation rate per mature egg injected was found to be slightly higher in the ZyMot group than the density gradient group. Not a lot. So amongst male factor infertility and recurrent pregnancy loss subgroups, there was no difference in the euploidy rate, fertilisation rate, blastulation rates, and the total number of blasts frozen, although the study was actually underpowered. In other words, they're making conclusions, but not enough data. They concluded, though, that microfluidic processing did not improve embryo euploidy rates compared to density gradient centrifugation in the sibling study, although fertilisation rates were higher. Now, the next one in 2024 was a group from Spain. And this is actually quite a complicated paper because they're doing several things at once. They're looking at the euploidy rate against DNA fragmentation, but they're making the distinction between single cases where most of the DNA damage was single-stranded breaks and those with double-stranded breaks. And you can tell the difference with a COMET assay by changing the pH, which separates out single and double-stranded DNA. So they obviously had some cases where the majority of the DNA damage was single and others were the double-stranded. And these results reporting are somewhat confusing. But basically, they're saying the fertilisation rate in 167 ICSI cycles was higher when using sperm from patients with normal or abnormal single-stranded breaks compared to when they're processed by the SSD compared to when they're processed by density gradient centrifugation. So the fertilisation rate is 69% compared to 58%. And then they reported looking at aneuploidy rate, PGTA. They also revealed a higher embryo euploidy rate in patients with normal and elevated or abnormal double-stranded breaks, DNA fragmentation, using the MSS device compared to the density gradient centrifugation. So when female age was considered, there were fewer euploid embryos in women over 35 years of age compared to younger women, independently of the single double-stranded break in the status of the sperm sample. But they did make a note that the number of euploid embryos increased in the sperm separation device preparation as opposed to density gradient. If you're confused, and so am I. Basically, high single and double-stranded break samples in semen samples decreased fertilisation rate and embryo euploidy rates respectively. However, the ZyMot device for sperm preparation increased both these rates, especially in couples that included women who were over 35. So here is a sense that it's very hard to make sense of it all if we try to look at the initial sample that you start with compared to as a predictor of outcome against the outcome looking at transfer of embryos. But it does appear that in this case, in their hands, the ZyMot did produce samples, regardless of whether single or double-stranded breaks, with lower levels of fragmentation and more embryos. Here's another group from South America, and they were looking to a clinical validation experience of the ZyMot. So in their hands, the ZyMot resulted in a pure sperm selection compared to density-graded centrifugation with far better motility. The fertilisation of sibling oocytes resulted in similar fertilisation rates and utility rates and no difference in embryo development. So in their hands, even though they had more motile sperm in the ZyMot sample, the fertilisation rate and utility rates were exactly the same. However, after changing sperm selection protocols from density-graded to ZyMot for standard IVF for all fresh samples with motile sperm, the fertilisation rates and utility rates significantly reduced, and cases of failed total fertilisation failure increased substantially. So some warning bells here. However, they noted adding a 5-minute centrifugation immediate change after the sperm selection process restored the fertilisation rates and returned the failed fertilisation rate to normal. So some warning bells here on its use. To conclude, the ZyMot sample selection device is suitable for standard IVF, but only after inclusion of a 5-minute gentle centrifugation process and immediate change prior to use. So in other words, the ZyMot does have some limitations. In 2025, in January, another sibling study. In this case, we're using frozen sperm and donor eggs, so they would be coming from younger women. The SSD was successfully applied in all 150 cases, that's still not a lot, providing adequate numbers to spermatozoa for ICSI. So obviously the samples had normal sperm counts. Additionally, SSD significantly improved the blastase development rates. However, this was of limited clinical impact, considering the minor improvements on the average number of top quality blastase. So even though they had more blastase being developed, it didn't really make a lot of difference to the ongoing pregnancy rate. So let's get to the last paper. And it's been a bit of a journey, but it's once again comparing density gradient, centrifugation, and overlay compared to ZyMot. The Spanish authors argue that if you look at sperm DNA fragmentation, was significantly lower in the MSD group compared to the swim-up group. So regardless of what happens, using ZyMot appears to significantly reduce the amount of DNA damage in the sperm preparation sample, not the original one, but one used for the microinjection. So, and then analysing the oocytes from the patient's own cycle, the sperm selection device showed a significantly higher rate of usable blastase per fertilised oocyte. However, this difference was not observed using donated oocytes when both cycles were combined. Embryos from the swim-up group showed a significant delay in time of pronuclear appearance and molar formation compared to those using the sperm selection device, being more marked in donated oocytes. No significant difference was recorded in the fertilisation rate and the remaining morphokinetic timelines. So in conclusion, this study provided valuable information on the use of the MSD for non-invasive sperm selection. When used, we observed a reduction in sperm DNA fragmentation and an enhancement in the number of usable embryos in their own cycles. These findings could be compatible with reduced capacity to repair sperm DNA damage due to poor oocyte quality caused by advancing age. So, summary. Sorry, need to go back. So those authors basically summarised their paper by saying the ZyMot device was not appropriate for all samples, as is based on microfluidics, motility is required. Therefore, additional sperm selection devices such as centrifugation may be needed as part of a clinic system. Additional benefits of the ZyMot device include time saving in regard to hands-on time, the simplicity to adopt to the protocol, easy training, and above all, a short chain of custody with fewer movements between collection cups, centrifugation, and the final preparation tubes. This minimises mismatching risks, especially in a clinic that does not require double witnessing. In conclusion, the microfluidic-based ZyMot sperm selection device has replaced density-gradient centrifugation for both IVF and ICSI. This study supports the use of ZyMot for standard IVF, but only after a 5-minute centrifugation media change prior to gamete co-incubation to remove residual seminal plasma or toxicity. But my last note here is that ZyMot is not a one-step solution to sperm preparation. It still needs a post-recovery gentle wash. What it does do is standardize the sperm recovery process that addresses directly any potential risk of sperm DNA damage, even if the DNA damage is not known, a kind of coverall technique. Apart from the need to redo the wash, there is no harm. There is a renewed interest in the sperm DNA fragmentation as a co-founding factor in embryo quality, especially for older women where egg quality may limit the ability to repair DNA fragmentation. Its use or any other similar product may become the normal, replacing density-degraded centrifugation techniques which have been in existence since I started in 1982. Okay, rather long-winded presentation. I'd like to thank you for your perseverance if you've got this far. IVF is indeed a personal journey that involves the action of many. It helps to understand all aspects of that journey, and I hope this information may have been of value. Tell others if you do. Okay, thank you very much.